Afternoon, everyone. Welcome to the snack program offered by the Rotary Club of Milwaukee. We offer this every Thursday at noon. And as you may already know, this program is a little different than our Tuesday program as there's less to it. It's only 30 minutes long, about 30 minutes long. And you'll find it to be not have any pledge or invocation or club business. Typically, we feature a member of Rotary or a Rotary connected organization, and they all are about ideas that are pertinent to how we're living today. We're not quite certain if there will be a snack next week, but stay tuned for that. Today, we will hear from Dr. Bob Gleeson, our fellow Rotarian, who's going to share with us another COVID update. Please feel free to submit your questions via the chat button at the bottom of the screen. I'll keep an eye on those. Mary also will. She's co-hosting with me today. And we will share those questions with Dr. Bob when his remarks are complete. So with that, it's my pleasure to once again introduce Dr. Bob Gleeson.
I'm going to go ahead and mute everybody right now. And Bob, you may need to unmute yourself then.
No, I'm good.
Okay, all right.
Good afternoon, everybody. Delighted to be back here and talking to you, and kind of sorry that I am back here talking about COVID. We all wish COVID would go away. We're all done with COVID, but it's not going away. COVID's not tired of us. We're tired of it. And I think at the outset, we should acknowledge that this is a time of great personal suffering for a lot of people. We're all starting to know people who are sick, who have been hospitalized and or died. We're starting to feel the pressures in our own family and businesses of what this pandemic is doing to everybody. Mary, you just changed the screen.
Oh, sorry.
That's okay. And but we have to recognize that this is going to go on for a while. And it's very unfortunate, but until we take the steps necessary, personal steps, and that includes masks and things that are pretty simple. They're about as good as vaccinations. Till then we do that, we need to get control so we can open up the pandemic. Mary, the only thing I can see is your name.
Oh.
So
I don't think that, I don't know why that would be. What about anybody else having that same issue?
No, I just have the speaker view. It's fine.
All right. We'll leave it on. Okay. So I won't know if I can share my slides. You know, we're starting to hear a different message from Biden's task force, and that's a message that we need to hear and we should have heard from the beginning. This virus is not going to go away. We're not rounding the curve. It's not all okay. You're going to hear messages from Biden's task force that are basically built around the Center for Disease guidelines on how to communicate in a pandemic. It's a 450-page manual, and it starts by presenting honest information, true talk about what lies ahead, and what we need to do to stay safe. In that regard, Ulsterholm recently spoke about the dark winter ahead, and we're going to talk about that and put it in perspective. When I was preparing for this talk, I read an article from mid-September, and they talked about Tony Fauci saying that we had 40,000 cases per day and needed to get it down to 10,000 cases per day. Well, we went in the wrong direction since then. We're now somewhere around 140,000 cases per day in America. The cases began exploding in mid-September. All right, I'm about to share a screen. Nope, I'm not going to share my screen. All I'm seeing now is a picture of Teresa, so I can't share my screen. If you look at a graph like the Wisconsin Department of Health puts out, you can see that the case numbers in Wisconsin are basically going straight up. Our case numbers, hospitalizations, and deaths are doubling about every 25 days. So it's a real problem. When Mary and she asked me back in June whether we could have meetings in the main hall at the War Memorial, I said we needed to get our case number down around 5 per 100,000. At that time, we were about 10 per 100,000. We stayed sort of in the 10 to 15 per 100,000 number until early September. Keep that in mind. I said things would be safe when we were below 5 per 100,000 cases. Today, we're at 107,000 cases per 100,000 people in the state of Wisconsin. Milwaukee, Ozaukee, Washington, and Waukesha counties are also clustered around that 107 per 100,000 cases. That's 20 times higher than I want it to be to feel safe. And that number will dictate what we do to stay safe in our personal daily interactions. Until we get the number back down, hell, now I'd even be happy if it was below 20 per 100,000. So our numbers are going up, and we have to stop and bend this curve back down. Even if we stopped cases today in Wisconsin, just stop new cases today, the number of cases and hospitalizations and deaths would continue to rise for a couple of weeks because we put there's that much in the pipeline that has to work its way through. A lot of pandemics are merely math. We just have to figure out what the right math is. Since July 1st in America, the 7-day average of deaths is 1.7% of the number of new cases, 2.1% of the cumulative hospitalizations. So it's the more cases we have, the more people are going to go to the hospital and going to die. And unfortunately, that puts us in a real problem. In Wisconsin, our 7-day case count average is 6,000 cases per day. According to the COVID tracker, we have 2,102 hospitalized patients as of today. It is simply mathematics. The number of deaths, you can calculate the number of deaths that will occur next week as soon as you know the hospitalizations. I keep hearing about a dark winter. Ulsterholm talked about the dark winter. There's a reason they call me Dr. Doom sometimes. So why will things be so bad? And what's the worst that could happen? So I think of this as a long tunnel. That tunnel is 5 months long right now. At the end of that tunnel, we have springtime. At the end of that tunnel, we're going to have vaccines. At the end of that tunnel, we're going to have some better treatments, but they're not there yet. So we have to get through this 5-month tunnel, and it's going to get pretty dark. Unfortunately, the darkness has to do with overloading our hospitals. Hospitals around the country are close to being overloaded. And by that I mean, in the springtime when we had clusters of cases in New York, a doctor or a traveling nurse could leave Milwaukee and go to New York or Dallas and provide health care. They can't do that now because now doctors are needed all over the country. So we don't have a backup supply. What we're missing is the backup. We're missing the backstops to a lot of these things. So now if we have an outbreak among healthcare workers in the intensive care units in one of our major hospitals, and 20% of them have to go home for 2 weeks or get sick and die, and that happens to them, there's no backup. We don't have other people to do this. So the real risk is that we overload the hospitals, or by overloading, I mean we have more patients than we have ICU beds, or we have more patients than we have doctors and nurses to care for those patients. And when we're almost full right now, A, the curve is going like this, and C, the flu season is about to start. So the real pressure, the real risk is that we cross the red line in the ability of our hospitals to care for us. And when I say that, I don't mean care for us if we have COVID. I mean, you push this to the limits and you have somebody with a heart attack who can't get in to the emergency room. You have somebody with a bad accident. They may decide that accident's, you're going to live. We're just not going to take you to surgery for a while. Or you may wait a day before you go to surgery. So those are when things will really begin to become dark. And that's why we have to flatten this curve so that it doesn't get there. Because all of our new treatments and all of the vaccines are all future. We're going to be living in a world where our ability to wear masks and self-protect ourselves and our family is the best that we can do to stay safe. So medical teams have learned a whole lot about how to stay safe or about how to treat COVID. But most of the care today is still supportive. We know we don't need to intubate as many people. We know they can put on oxygen hoods that help people get enough air into their lungs without intubating them. We know when to intervene. We know better what normal drugs to give or how to treat people. But we do not yet have an effective antiviral or an effective way to help our immune system. There's a lot of talk about remdesivir. Remdesivir is in limited supply, and some providers in print and reputable journals kind of regard remdesivir as mediocre. It's going to help a few people get better. It's going to help a few people reduce the length of their hospitalization, and it's going to reduce a few deaths. But it's a few. Yeah, if it works for you, that's great. But it's not like giving penicillin for strep throat. So we shouldn't think of remdesivir as this wonderful cure-all drug. It's good, but it's not the super thing that we've been promised it is. Furthermore, the drug's hard to get. We have these new monoclonal immune boosters. Bamlanivimab, I had this done before I did this talk. I could almost do it. Bamlanivimab. And it is the monoclonal booster. So we're taking antibodies that we've basically learned to harvest from plasma, and we're learning how to make those in a test tube, and then you can make them in a great big vat, just like you make a beer. And they are effective. Again, they are effective in limited cases, and we're not quite sure whether we give it early in disease or middle disease or late disease yet. So we'll learn a lot more. But as of this time, it's an incredibly rare drug. It's not something that we're likely to get a lot of. Now, there are going to be more drugs in the pipeline, and you're going to hear about more, but nothing is proving to be a knockout kind of treatment. So I look to treatment to help us on the margins, but not really cure this disease. And that may be true for at least several months, if not a year. So let's talk now about vaccines. So when we talk vaccines, we have to remember it's not the vaccine. It's the vaccination. So until we get those shots into patients and into a lot of patients, we're not going to see much effect. And we have several challenges. We have a large anti-science and anti-vaccination program, anti-vaccination movement in America. That's going to be a real hurdle in order to get enough people vaccinated. The vaccines are going to be very difficult to administer and distribute. The first two vaccines, the one by McCormick, or Pfizer and Moderna, both require 2 shots. And by the way, you have to get the same vaccine in both shots or it won't work. And there are huge storage problems. Pfizer's medication requires that from the time it's manufactured until within 6 hours of it being administered, it has to be kept at 94 degrees below 0 Fahrenheit. Moderna's has to be kept at -4 degrees. In order to meet both of those, UPS and FedEx have already designed freezer storage units that can go from the manufacturing facility into a truck, into an airplane. So they're built to just go down the fuselage of an airplane and all the way out to distribution centers. But you're not going to get this FedEx storage thing at your local doctor's office. You're going to have special sites that will have to be chosen where the drugs can be administered. Once the glass vial, it's a multi-dose glass vial, is opened, it has to be used within 6 hours. After 6 hours, you throw it out. So that's how sensitive it is to the cold. So that's a huge problem for distributing these vaccinations. Then we have to have a program where we can get, let's assume, 2 shots into everybody in America. Who gets it first? Well, that's pretty easy. Healthcare workers, first responders, essential workers. By the way, I put grocery clerks and bus drivers in essential workers. I put the clerks at Target in essential workers. Because I don't know about you, but I look at the people that I rely on to get my daily life livable. Let's call that somewhere around the range of 20 million people. So the first 40 million doses will go to those essential and workers and first responders. Then we need a whole national program to line people up to be able to, we don't really have the facility. We don't have the mechanisms in America to take people and move them forward in a way that's going to say, this is how we're going to get medications to you. Think about it. It's actually very difficult. It almost requires a military kind of thinking to organize a mass vaccination program like this. Now, until we get the vaccination program up, running, and enough people vaccinated, there are things we can do to stay safe. And we have to remember that even after we do the vaccination program, we will probably be doing social distancing and masks and limited participation in closed events or at public events, gatherings, until we get the case number back down below 5 per 100,000 people, if not lower. And that could take a while. So let's talk about the most dangerous things to be doing right now. Number 1, you want to avoid anything that's going to look like a super spreader event. And a super spreader event is not just the Sturgis rally. By the way, I happen to think that the outbreak in early October in Wisconsin, North and South Dakota, and Iowa was largely due to the Sturgis rally. They can't quite prove that. They have 300 cases at least that were due to the Sturgis rally. I think it's bigger than that. Super spreader events may account for 80% of the cases in the country. That's kind of the 80-20 rule. It's also called the Z factor instead of just the R naught. What's another super spreader event you can think of? There are 3 of them in the White House. Amy Barrett, the Pence office, and the election night. Election night, we're already up to 8 people who've been infected. No masks, gathering in large groups with talking in close contact. That's how you define a super spreader event. So whether it's a bar in rural Wisconsin or the White House, you need to stay away when people are gathered together without masks and when they're in close proximity and when they're talking. That used to be the earlier, the thinking. I mean, first it was nursing homes, then it was these super spreader events. Now our super spreader events, and there was just an article in the Washington Post today, are really game nights and family gatherings. When you gather 20 people together for a family event, let's call it Thanksgiving, we're gonna have one person's gonna, there's so much infection throughout the community now that the other people are going to be infected when they're at those dinners, meetings, game nights, social cocktail hours in the club, whatever you want to call it. We're pandemic fatigue, so we're doing more things and we're widening our social bubbles every time we do that. And these family gatherings are small gatherings, 4 or 5 couples getting together for game nights or a cocktail, even if you're sitting outside. Think about all the bubbles that come from all those different people and all the people they're in contact with. That's how this is spreading. Because today, most schools in the Milwaukee area are reporting a couple of cases in kids. The kids are going home, they're infecting people. It's in the community. And so we need to break that transmission by really getting rigid about how big a group is or what we're doing. My son drove up from Chicago yesterday because he had a meeting and he came home for dinner. We sat in the kitchen, Jana and I were at the table. He was about 10 feet away at the counter while we ate. Until we ate, we had our masks on. And the 2 of the windows in the kitchen were open. Yeah, we had space heaters on. But that's what I do when I'm with even just one person like that who's not in my direct social bubble and we're inside today. You want to avoid gyms and bars. Gyms are particularly bad. People are working out hard, they're exhaling, they're blowing coronavirus all over the room. And I know that they've been opened and I know there's a lot of pressure to do that and there's a lot of pressure to open bars, but we need to avoid those places. The state says you sort of need to avoid any gathering with more than 10 people. My number is somewhere around 4 or 5. Becomes my maximum people I regard as safe. So I'm actually quite paranoid about this disease. I don't mind dying. I do mind becoming a COVID long hauler. I don't want to do that. Having said all that, I go grocery shopping. I go to Target. Some of it I do by ordering ahead, but when I go grocery shopping, I go at 8 o'clock in the morning. The store is quite empty. I'm sorry, I can't turn that off. There it goes. The store is quite empty. If I walk past somebody, I mean, everybody in my store, it's 100% mask wearing. And I'm in and out quickly, but I'm never near anybody for more than a couple of seconds as I pass them in an aisle or go around them by the vegetable counter. I gather outside with my neighbors. We may stand 10 feet away and park or and talk. We walk in the park. So I don't regard myself as limited in how, yes, I'm limited. I can't go to theater. I can't go to restaurants. I do takeout to support the restaurants, but I'm only partially constrained. I don't feel that my world is totally upside down and limited. And we have to get back control of this pandemic by being really serious if we want to get back to the place where we can go theater and eat in a restaurant. So what's as good as a vaccine to stay safe? Following those rules on social distancing and knowing when you're at risk and avoiding those areas. And then masks, masks, masks. Never leave your home without a mask. Wear a mask. If you're taking a walk and you're in a park, I always have my mask, and Jane and I always pull it up and put it on. We'll start about 50, when we're about 50 feet away from somebody, we'll take it out, put it on. We'll keep the mask on till we're past them and then take it down. That's a courtesy to them. It also protects me. My mask protects me. Your mask protects you. It goes both ways. So we're protecting other people and we're protecting ourselves. Social distance. Maintain your social distance, maintain your social distance, and avoid crowds at all costs. So if you must be inside, open windows, be distanced, or use a room HEPA air filter, something like that. And you can stay quite safe, and that will help lower and bend the curve downward. Okay, it's going to be a dark winter. I'm sorry. I know I have a reputation for being Dr. Doom, but I haven't been wrong in what I've predicted is going to happen so far. And by the end of this year, we're probably going to exceed 400,000 cases a day in this country. This is just out of control. So we all have a duty and responsibility to ourselves and to each other to get this disease under control. I have a friend in Oregon who's going to watch this program. Oregon is sitting there right now with about 10 cases per 100,000 people. Our numbers are 10 times higher than Oregon's. We need to do what Oregon is doing. And we need to start to get with the program so we can flatten this curve, or we're gonna be in a very dark winter. And I just don't want any of us to be there. It's our responsibility and our duty to take care of each other at this difficult time. So with that cheery note, Teresa. And
thank you, Dr. Bob. That was really depressing, but very helpful. I appreciate that. Questions for you from the chat. Bill Coleman's really asking about Milwaukee, the metro Milwaukee area. What's caused the sharp rise here in Milwaukee County? What is the situation with hospitalization and ICU beds and any hot spots?
Bill, that's a really good question. I did not focus on hospitalizations and ICU beds in Milwaukee. But I will. So the pandemic right now is much, much worse in upstate Wisconsin than it is down here. Upstate Wisconsin is running almost 50% higher than we are. We have a cottage near Wausau. We drove past a couple bars after we went hiking in Rib Mountain State Park and came home. And the bars would have, they're small bars in the country, they'd have 18 cars in the parking lot. And their pandemic up there is just out of control. The cases in the Milwaukee metropolitan area are largely driven right now by community spread. Yeah, there's just so much disease that it's hard to keep it away from our area, our denser population than upstate. And nothing really accounts for it. There was no single thing or event that has made this bad in our area. It's just the nature of this disease. Ulsterholm uses the phrase that this is a forest fire and we're all dry kindling. You can say that, gee, Milwaukee or Wisconsin, you know, in America, we've had like 12 million cases. Let's say that's low by half. Then we have 25 million people who've been infected. That still leaves 300 million Americans left to be infected. So that's the dry kindling, and we should all think of ourselves kind of that way, as dry kindling that we need to keep the sparks away from ourselves.
Thank you. Jenny Sevenich did post in the chat a link to the Milwaukee County website that has information for the county on cases, deaths, hospitalizations, and hotspots. So that's available to everyone.
Jenny, if you've read that, do you want to answer Bill's question? I looked at state numbers. I didn't look at county numbers today.
Yeah, well, I can't answer it completely, but I can tell you that the hospitals are extremely stressed. There are beds available. However, the staff is being redeployed. And so there aren't enough staff to staff the beds necessarily. So while they may technically have ICU beds and medical floor beds, they're really being stressed because their staff are now getting infected through community spread, not at work, but through community spread. And so you may have seen that Aurora had to close their community testing sites so that they could redeploy those staff to be at the bedside. They're having to use, you know, hospitalists, and by they, I mean other health systems as well, having to use hospitalists on the floor and asking specialists to then do what the hospitalists were doing. So, you know, it's kind of like a shell game. They're very, very stressed right now.
And when I talk about the dark winter, you know, I mentioned that our cases are doubling around here about every 25 days. So if we're at the stressed right now level, just double the number of COVID cases, follow the math, and you can double the number of people in the hospital. That's when we're really going to start to feel this. And I'm a bit Dr. Doom today. I happen to think, by the way, I'm accurate in the numbers, but I'd rather tell you now than have you be surprised in early December and say, why the hell didn't somebody tell me I couldn't get in the hospital? I'm having chest pain and I need a cardiac cath. Why didn't you tell me that I can't get in the hospital for cardiac cath? Because that's what we're kind of headed toward if we don't get a control of this. And it's, as Jenny said, it's as much the doctors and nurses as it is the number of beds and ventilators.
Right. I had a question for both Jenny and Dr. Bob, and that is there anything that we as individuals or Rotary as a club can do to support the healthcare workers?
I would say probably not. Jenny?
I would say if there's
I got one. Donate to Jenny's clinic.
If there's any way that you can visibly show your support or vocally show your support, we went from healthcare workers being heroes and lauded as heroes to, for some, being villains. And that really wears on the soul, and as well as just working under these conditions for months and months. You know, it's stressful for everybody, but then add that you're seeing sick people. We're having patients who are dying. You know, we're getting more, we've always had high infection rates here, but we are once again seeing a number of our patients die. And that's depressing for our healthcare workers. So if you can just vocally or visibly show your support for healthcare workers and all essential workers, that goes a long way.
So the last time I gave this talk, I asked how many people knew somebody who was sick with COVID or had been infected with COVID. So I'm going to do three parts to the question. How many people have a family member who's been infected with COVID? Raise your hand. muted me. There are a lot of people that I can't see their hands, but I would guess on the people I could see, I would guess that half the hands went up. How many people know, not a family member, but just know of somebody who's been sick with COVID enough to go to the hospital? This is the community spread, guys. This is what we're going to see. How many people know somebody who's died from COVID? Not, okay. And it's not for me, it's not that far away from personal contacts. So I predict that next time everybody's hand will be up for the first two questions, and half the hands will be up for the question about death. And that's, so we've gone from no hands up or almost no hands up to at least half the hands up for most of this.
I jump in with a question and also a statement is I tried to unmute everybody, but I guess I can't unmute everybody, but everybody can unmute themselves. And I think that we probably could jump in with questions. So I wanted people to know that. But I would guess that many of us might have this question, which is that in December, my son and daughter-in-law and infant granddaughter are going to be coming in from New York, and they will get a COVID test before they come. They'll still have the flight. And then we would get COVID tested before they come. What is the time frame and the turnaround, and how can we maximize our effectiveness in getting those tests before we see one another?
I would say better than the test is that they should quarantine, everybody should quarantine themselves for 2 weeks before you get together.
Yeah, my daughter-in-law is a OBGYN physician at Bellevue, so she's not going to be quarantining for 2 weeks before she comes.
No. But for everybody else, you quarantine for 2 weeks before you get together for a family event. And I wonder whether you will get together at Christmas time. The numbers will still be going up. We will probably be at the range of 300 or 400 or 500,000 cases per day in the country. And you may just decide that that's too risky to do. Because this is going out of control, we run the risk that we're about to go over the curve and really nobody will want to do anything and things will tighten down much harder. The tests, if you're exposed on day 1, day 0, I'm in contact with somebody who coughed in my face. Days 1, 2, 3, and 4, the test will be negative. The test will not turn positive, reliably positive, until day 5 after my exposure. So a test on Tuesday, if they fly here on Friday, yes, it gets you some pretty good evidence, but it's given the spread in the community, it's hardly foolproof that they're safe. The resort I go to in the Caribbean, you have to have a test before the British Virgin Islands. You get a test at the airport when you arrive in Tortola. On day 4, after you're on the island, you get another test. And on day 8, you get another test. So they're worried about that time when you took a test and then were exposed the next day. They want to catch all of that to try to keep the disease away from their islands.
I just want to recognize that it's now
together for Thanksgiving or Christmas. We will do dessert with one family outside around a bonfire. We will do a glass of wine with another family outside around a bonfire for about half an hour, 45 minutes each, and that's it. Those are our holiday plans.
Dr. Bob, Anthony McHenry was asking if you foresee down the road that institutions will mandate vaccinations for their employees or for entertainment or schooling.
I don't know about institutions. I know about things where your participation is voluntary. So I think a vaccination will be mandatory before you go on a cruise. I think vaccinations will be mandatory before you get on an international airplane. I think vaccinations will be mandatory before you go to some countries. How far back it goes to institutions, I don't know. And that gets into some of the legal stuff about, and our bitter political fights today about individual rights, and you can't tell me what to do versus keeping society safe.
And Pat Algiers asked, what do you think our national stand should be? Mandatory shutdowns or what?
No, I don't happen to think we should do mandatory shutdowns. I think enough people will say, I don't want to go to a movie theater and sit with other strangers. That becomes our form of shutdown. It's what we want to do to stay safe. And I do think that we need to identify the places where we have hot spots, bars, gyms, restaurants that are crowded, and we need to limit those or control their attendance or hours or something. We need to find events as they did in New York. They were, I mean, there was a wedding party in Long Island and there were 100 people there and 30 people are infected. You know, we need to be sensible about this. The state made a ruckus about a religious group that wanted to have a large wedding of several hundred to 1,000 people. This was a big deal in their community. And the governor of New York got in a lot of trouble, but he said, you can't do that. And that's the kind of thing where we have to limit because it just doesn't make sense.
Dan Fetterley asked if you, I'm sorry.
You will see very different messaging from the Biden team on COVID as they start to grapple with, they can't do anything. They have no power till January 21st with what needs to be done about the epidemic, but they're going to start messaging about what we have to do to stay safe.
Dan Fetterley asked if you would comment on the Great Barrington Declaration, of which I do not know.
Enlighten me, Dan. Enlighten all of us. Unmute your phone.
Yeah, they're basically of the view that because problems with COVID don't affect each segment of the population equally, you should protect the most vulnerable while allow the less vulnerable, the younger people, the children, to assume a more normal life.
I don't know that I agree with that. I personally think that we're better off to, there's one theory that says you give it to children because children bring it home and give it to mom and dad and grandparents, the vaccine. There's another theory that says children are okay, but you need to give it to the young parents because they have children to take care of. And if we're going to rebuild a business, so I'm talking about who has the energy to open a new restaurant? Who has the energy to open a new factory? Who has the energy to build what needs to be built? It's the 30-year-olds. And we need to protect them so that they can rebuild and get us growing faster. I don't know, quite frankly, I don't know that, yeah, I don't want to die, I get all that, but I don't know that my life contribution is that great that it needs to be worth saving. I would rather give my vaccine to my children because they have a future. I'm 73. I had a life, they have a future. And to me, there's a big difference. So there's going to be a big argument about who gets and debate about who gets the vaccination first.
Mm-hmm. Thank you.
Well, does anyone else have any other questions? Oh, I'm sorry, Beth.
Yeah, I was just going to say the other Fetterley on the phone call is feeling a lot of appreciation for you right now, Bob. So when you're talking about your value, I think the value of the wisdom of people who have experienced and learned throughout their lives cannot be understated either. Because I think if I'm reading my dad's mind, we're both thinking about what we're doing for Thanksgiving.
Eating turkey outside.
It's still an open question.
I have to say I agree with it. I think the wisdom of people who are older is very much needed now. My story is my father succumbed to COVID on May 28th. He was 94 years old. He was a doctor, historian, and scientist. He called in early January that this would be a big problem. He knew it. He knew it was coming down. And he was very concerned about the dismissal and denial from two camps, both our governmental official and the global medical community. So I think those like Dr. Bob, who are wise and are leading the effort, are incredibly important to all of us now.
Well, thank you very much, Pat. You know, my message is discordant with what everybody wants to hear because we haven't been told the truth yet. And we should have been told for 6 months now how serious this was. And then maybe we wouldn't be where we are today. Wisconsin's one of the worst places for infection in the world. And we don't have any understanding of how bad it is. But it doesn't have to be this way. We can make it better.
I'm going to jump in. Teresa is having some internet issues again, so she asked me to either continue or close out the meeting. It's 12:45, so we have exceeded our usual 30 minutes, but it seems like people are engaged and have questions. We can go for a few more minutes, and I can look in the chat here.
I'd love to hear I'd love to hear some cross chat between the people, the participants today, and what their thoughts are.
Well, everybody can unmute themselves and just jump right in.
I would say that we've already canceled Thanksgiving plans, basically due to the fact that there is so much COVID in Milwaukee, and there were too many people flying and potential for cross-contamination and no way to have people sequester themselves. So,
Dr. Bob, do you have any type of mask that you recommend? I've heard some things that some of them are worthless.
Oh, so Jane read a great test for your mask. Put on your mask, hold a candle in front of you, and see if you can blow out the candle. If you can blow out the candle, the mask is no good. It means your air is going through it. If you cannot blow out the candle, the mask is fine. So we happen to use the paper ones that are a couple layers thick, kind of just think of them as a surgical mask. We buy them in a box of 50 or 100 and, you know, you go through that a month. So, because I like to use newish masks periodically, I don't always wear the same mask.
Dr. Bob and group, this is Jessica Gatzke. So from a business owner's perspective, we're looking at, again, reducing the count of individuals that we have in an office and really restricting it even further than we had before. We still have restrictions in place and most people are remote working, but now we're going to bring it down to who's critical to be there, and we need to protect them to keep them there, and everyone else needs to stay remote.
Anybody want to respond to that? Yeah, I happen to think most people are doing that. I mean, frankly, I think sometimes Target is really happy when I order online and they deliver to the car because it's one fewer person exposing their workers to an unknown.
So Dr. Bob,
go ahead.
Oh, I had a question. You didn't really talk that much about schools.
Uh,
So my kids are full 5 day a week. And I feel like the protocols that they have in place seem to be working because the kids that are being infected are getting it outside of schools. And, you know, my daughter's been quarantined for 14 days, but she
never got it because of the protocols that the schools had in place. And I was wondering if that's what you were seeing too, or if it is being passed at schools.
Christine, where's your daughter go to school? Mequon?
No, she's at Waukesha Catholic.
Okay. So I live in the northeast side of the county. We have a private school here. There was an outside high school party that resulted in the high school being closed down for, I don't know whether it was a week or two, should have been 2. I have one granddaughter in Wauwatosa who was infected. She's the only person infected in her grade. Well, that Wauwatosa school did not close any grade or cancel anything. Every kid just continued in school. I have a granddaughter in Mequon in 1st grade. Somebody in her class was positive, and they're all sent home for 2 weeks. So one of our problems is we have this inconsistent messaging about what should be done when somebody is infected. The experience from the European Union is that with the proper steps, kids can stay safely in school. And that may have something to do with the fact that they get, they're so little infected by the virus. Some kids have a bad outcome, but for the most part, children tolerate the virus pretty well. And they're staying in school in Europe, and I think it's okay here. I'm okay with kids being in school, but I don't have a good answer. The real question will be when all the college kids come home for Thanksgiving.
All right, thank you.
So, Dr. Bob, I have a question about the vaccinations that have to be stored at -94 degrees.
Mm-hmm.
How does injecting a substance into your body at -94 degrees work? That feels like that would be something you would not want to do.
I don't know. I haven't read anything on the process of how much they warm it up. Jenny, you don't know, do you? Yeah, I haven't done that. That's about the temperature of dry ice, and so we clearly can't inject that. It just can't get very warm for very long. Maybe you bring it to room temperature and then you have to give it within 6 hours is probably what I'm going to guess they're going to do.
I'm not unmuting there. Any more questions for Dr. Bob while you have his attention here? But
I'll email me too.
I know he's available, and some of us have taken advantage of that. So thank you. A little virtual applause here for you, Dr. Bob.
Sorry it's gloomy, but we really have to understand this is serious. Nothing makes me crazier than to hear people say this isn't important. Because we're all starting to know people who are getting sick. So thank you.
Thank you. All right, everybody, enjoy the day.
Sun is out. Let's go enjoy it.